energy and constant yawning all day? Hey, you could be suffering from poor breathing while you sleep. Many middle-aged dad entrepreneurs suffer from fatigue and brain fog despite sleeping their full 8 hours a day. They may have tried over-the-counter sleep meds, eating healthy, exercising, but still they know something is not right because they struggle to wake up, they yawn all the time, and they can't think clearly. Did you know that one of the most overlooked cause for this type of fatigue and brain fog is actually snoring and breathing challenges at night? In the next few minutes, I'm going to show you how you can breathe better in your sleep, fix your snoring problem without resorting to surgery or using a CPAP machine. For the entrepreneurs who want to stop underachieving their potential because of fatigue and brain fog, but you want to live this energized, focused, executive warrior life. My client private list is nearly full, but I do have 2 openings. So if you're interested in getting my help, drop me a line below this video and my team will reach out to arrange assessment call. Hi, I'm Stephen Coe, a biohacking executive coach. I've guided middle-aged dad entrepreneurs and executives from all over the world to gain more energy in their 40s than they had in their 20s. What you're about to learn is part of my executive biohacking system that took me over a decade to perfect, and I hope what I'm about to share with you will supercharge your ability to achieve just like it did for my private clients. Snoring or poor breathing is one of the biggest causes of low energy for male entrepreneurs. In fact, multiple research shown that over 57% of adult men snore, and this increases with age. Some snorings are so bad that you literally stop breathing many times a night, and this is a serious problem because if you don't address it, it's more than just low energy and yawning. It's going to contribute to obesity, diabetes, high blood pressure, heart disease, and stroke. In the next few minutes, I'm going to show you the biohack method for fixing your breathing issues without resorting to surgery or invasive medical interventions like a CPAP machine. First of all, let's get the disclaimer out of the way. If you are using a CPAP machine now, currently as prescribed by your doctor, do not stop using it without consulting with your doctor. That is very important. Now that's out of the way, let's talk about snoring interventions. A lot of the focus on addressing the symptom. Snoring. Get rid of snoring, you're better. Unfortunately, interventions like CPAP machine and devices, they cause side effect, right? It's called a constant air pressure machine that forces a constant pressure on your lung to prevent it, to clear the airway, to help you breathe. Now, depending on the machine, a lot of these can cause side effects like dry mouth, dry nose, eye irritation, nasal congestion, and sometimes even chest pain, right? So it's not particularly pleasant. It's annoying. You have to take it with you. It's a thing that you have to put on your face. And other people, they don't want that, so they resort to surgery to open up your upper airway, which often involves like inserting this rigid fiber implants into your nasal cavity or some chemical injection to kind of harden and create this inflammation to harden a particular part of your nasal structure to prevent it from collapsing. Okay, so a lot of these, look, there's a place for surgery, but it's very invasive, right? It comes with side effects. Often they don't work. What you don't know is a lot of these surgeries have never really been tested. It's more like, let's try it and see if it works, because it's practically unethical to test it on people, right? You can't say 50% of people, we're going to cut you up, sew you back together and do nothing, and 50% we actually do something and see if that's working. Can you see there's some ethical issues? So surgery in itself often do not work, and unfortunately, it's already done. Once it's done, there's no going back, right? It sometimes creates this permanent change that you can't fix it. They'll probably sell you another surgery to fix it, so you really don't want to go there unless you have to. A biohacking executive will try all the methods that I'm about to show you first, right? They will actually do that before thinking going drastic, like a major invasive medical intervention. They will only do that as a last resort. There's a place for that, but let's not do that as a default because we care about our performance. So you want to work with your body, not just cut it up, cut some piece out, or put some intervention and just fix the symptom. Let's fix the issue. And fortunately, there's a ton of things you can do in biohacking to help you stop snoring and breathe better without resorting to surgery or CPAP machine. And there's 2 kind of specific methods that I'm going to share with you today, right now. All right. First, during the day, breathe through your nose. Why is that important? A lot of my clients, when I listen to them speak, you can literally hear the mouth breathing, and it's particularly pronounced when they're doing a speech. So I coach a lot of my executives, and they present in front of their kind of department. They present in front of the company, and they're on the mic. You can literally hear the mouth breathing when they talk, right? And there's a lot of side effects to this. You can actually read about it by James Nestor. There's a book called Breathe, where he, as an investigator, he went and did an experiment where he completely blocked his nose and breathed exclusively through his mouth and see what would happen. And it's all medically supervised, so you do not want to do this, right? When you breathe through your mouth only, it literally creates inflammation, right? Within days, his nose is congested. He's starting having asthma symptoms. He's starting having all these issues. He's sleeping poorly. And guess what? That very night, when he has nose blocked, he started snoring. He's never snored before, and he started snoring the very first night, not being able to breathe through his nose. And that is the impact of mouth breathing. Beyond that, it literally changes your facial features. It makes your face literally collapse. Okay, so that is going to interfere with your breathing, not just throughout the day, but of course in the night you're going to start snoring, and that's what we want to get rid of, right? So breathe through your nose throughout the day, and the way you do this, and this is something I'm going to show you now, not just breathe through your nose, have your tongue practice using your tongue. See, this is your cavity, right? Mouth cavity. Have your tongue push up again, sorry, like this, or like this, doesn't matter, you know what I mean. Push your tongue up like you're lifting weights with your tongue. Lifting up, what that does is push it up the cavity and breathe through your nose consciously, strongly, forcefully. As you push up. Practice multiple times throughout the day. Just get, whenever you think about it, do it, and this will naturally expand your nasal cavity behind your nose. Now, your nose, this is literally the tip of the iceberg. The entire cavity structure behind your nose, it's like a little apple that's hidden behind your face. And as you push up with your tongue constantly, right, what you're helping is changing your literally bone structure, helping it expand and open up. And that will improve your ability to take in oxygen. And that doesn't just help with mental alertness, clarity. It's going to help you perform better at sports. It's going to help you perform better at everything that you put your mind to, being able to breathe better. Takes a lot of practice, and that is what you need to do during the day. If this hasn't worked as well as you expected, there is some medical intervention that you can put they're basically a specialized type of dentist. They will put in a device in your mouth that help push up the roof of your mouth to kind of expand that cavity, behind your nose over time. That's a more of an invasive intervention, a medical intervention, but it's not nowhere near like a surgery. It will create a permanent change, increase in your ability to breathe better, and that for some of you, if you've been breathing through your mouth all your life, this is going to change everything, right? It's not a damaging thing for your nose, so it's going to help you breathe better by actually expanding your nasal capacity behind your nose, right? Behind just here. Okay, so that's a key thing that you can do today. What about at night when you go to sleep? Okay, you sleep, you're not conscious. Of course, you're not going to think about breathing through your nose, right? You're asleep. So one of the main tip, and this has changed the life of many of my clients, go and Google this thing. What the heck is this, Steve? It's tape. It's simple as that. You tape up your mouth, and this is just a kind of a, kind of wound tape that's kind of skin friendly. Literally get one of this. You're going to tear a piece, and there's a way to do it. Tuck out your mouth like this. Then sorry. It's going to look a bit like a weirdo, but I promise you, try this. You'll force nasal breathing at night, and you're going to breathe better. A lot of my clients would just say, Steve, I feel so good taping my mouth, right? Just doing this little thing. It's cheap. You can buy like specialized mouth tape. It's so good that there's entire company built on specialized mouth tape with a little hole in it. But I find that a standard kind of wound dressing tape work just as well as what you can buy commercially. It's a lot cheaper. You've got nothing to lose, right? A few bucks, a few dollars, and it works a treat. So that's one of the first things you can do. Another thing you can do is to make sure you sleep on your side rather than on your back. And why that is, when you sleep on your back, your tongues fall backwards and that constrain your breath. So now there's a few ways of dealing with that. You can use a snore guard, which forces your jaw forward, expand your capacity and your breathing capacity, and prevents your tongue from falling backwards to obstruct your breath. So you can do that, but an easier way without resorting to that is to sleep on your side. And this came from actually First World War, which is a really interesting story. First World War, imagine you're a soldier, you've been fighting for days and days without sleep. When you have a chance, guess what? You sleep as much as you can. And guess what? When you start to snore, they know where you are. They shoot at you. So they found out that if you sleep on your side, you can actually stop snoring. And that's what they did. They started to sleep on their side. And a lot of you will be wondering, how do you actually do this? Because you're asleep. You don't know which side you're sleeping on. Here's a hack for you. Get a backpack, open it up, okay? So just a small backpack, open up, stuff it with towels, nice soft towels, and then you're gonna put this on, okay? And then you're gonna go to bed, right? Nice and tight. Again, weirdos, but who cares? You sleep and you perform like a champion during the day, right? It's worth it to look like a bit weirdo at night. And maybe don't do it if you're with someone special, but if you're just sleeping and you care about your performance, put in your backpack, and when you roll to your back, guess what? It's uncomfortable, so you naturally lean to your side. And this is a bit of a hack that I've used for my wife actually to help people stop snoring. Some of my clients do that, and that's a hack, a free hack that costs nothing. And lastly, you can get those nasal strips, okay, that will actually expand, kind of pull this back, expand the cavity. And one particular brand that I actually think it works better than a strip is called Mute. Mute is like little silicone pieces that you put it up through your nose. Now, I'm not going to show you, don't worry. You wouldn't want to be watching me stuffing something up my nose. You put it up your nose, and literally it's like a circular tube, kind of little tube, and just expands like this. Okay, and then you push it up, it expands your nasal cavity and helps you breathe better at night. And very often you stop snoring completely just by doing that. Okay, so I've given you a couple methods to help you sleep better without resorting to kind of invasive things, without the side effects, and not like permanently transform your doing any long-term damage. Right, surgery can potentially do that. All the things I share with you is low cost and it can permanently transform your breathing over the long term. If you do this on a consistent basis, you are doing a permanent upgrade. Once you're there, you don't need to do it like as conscious anymore. You just feel and perform better. Okay, what do you do with this information? What you can do, and this is what I recommend my client to do, is just try everything. Get a backpack, expand your nose, sleep on your side, practice breathing. Just try it all. Okay, because this is the difference between a system mindset and a reductionist mindset. Reductionist, aka science. Now, I'm a trained scientist. I have a Bachelor of Science with honors, so I can tell you what science is. Reductionist is a typical scientific approach where you just reduce everything to a single factor that you're trying to test your hypothesis and see if it works. Unfortunately, your body don't work like that. Your body is more like bread. What? Bread? What I'm trying to say is your body is a system of multiple factors that it's impossible practically to eliminate all variables and just focus on one thing. Bread, when you bake bread, you have water, you have flour, you have oil. And when you mix together, you bake it, you get bread. You take one ingredient out, you do not have bread. Make sense? You just bake the flour, you get very hot flour. If you bake the water, you get very hot water. You do not get bread. Right? You have to bake all things at once. It's an interaction of things. And that's the difference in mindset. A biohacking executive, we understand it's a complex interaction of systems. So everything feeds into each other to get the fact. Get the result first. Get the result first. I want to emphasize that. That is the only thing that matters for it to work for you. Once you get the result, cut back. Right? So you say, okay, now I'm sleeping on my side, I'm taking in my mouth, I'm doing the Mute thing, I'm doing nasal strip, I'm breathing throughout the day, and I feel amazing. Okay, do I really need to do everything? I'll get rid of the backpack and see if I still snore. Do I sleep better? Or don't I sleep better? Or it gone worse? And then you can take things out until you get it just right, which is the opposite of the reductionist thinking, which is treating your body as if there's only one factor that matters. and then try. That's how you not get it to work, right? For you, it's all about result first. Focus on that. Try it all. Report back. Let me know how you go. The second thing I highly recommend is to get a snore monitoring device. Like you can get an app that records the sleep sound, so you can see when you sleep, are you actually snoring? Or you can get a Oura Ring like me, which actually measures your oxygen and also the breathing frequency to see if you're actually suffering from potential sleeping issue. Now, Oura Ring costs a bit of money. I think it's worthwhile the investment. I'm not getting paid by them to recommend them, but it's given me a lot of actionable metrics that's really transformed my personal performance. So I highly recommend that, but you don't have to start from there. Just get a sleep app, which you can download for a few bucks off App Store, off your Play Store, and that will also give you some like concrete measurement. Sure, you can ask your partner if you're snoring at night, but you might not get that consistent data. And for us as biohacking executives, we want data because that gives us feedback. It helps us adjust our routines and optimize for peak performance faster. Now, being able to sleep properly throughout the night is so fundamental to everything we do. And that's why it's the first step in my executive biohacking system. Once you have the sleep sorted out, you sleep throughout the night, you don't have to wake, you have this energy, and that will help you move on to the next step of my system, which is about having a resilient warrior body. The warrior body is how you build this mental grit, toughness. You use the body to reach your mind, but also gives you energy. And then we want to layer that with the warrior diet to fuel your performance, and then helping you develop a warrior mindset to drive it all, right? When this is working, you can take all this energy and channel in the right way. Now, drop me a line below this video if you think I can help you with any of this and helping you with the implementation of this. And my team will reach out to arrange an assessment call with you. All right, I hope you find this video insightful and useful, and I really look forward to hearing from you. If there's anything that I missed, any questions that you have, drop me a line below. I'll read all comments and I'll answer them. Okay,